complicated grief is different from ordinary grief, from uncomplicated grief, because, well, grief is always very, very challenging. The world, after you lose someone close, the world is completely changed. And so you do have to navigate a whole new life for yourself, really. But most people do that. They don't lose their grief, but they do find a way to have a life that has purpose and meaning in it, and the possibility of happiness. And the grief kind of gets reshaped and interwoven into the life that they're leading that is a happy life still. So people with complicated grief really can't do that. They just don't know how to remake their life in a way that has a sense of meaning, that has the possibility even of any kind of joy or satisfaction in it. And so that's really the difference. Complicated grief has some symptoms that are kind of like depression, and people get them confused because you're sad when you're depressed and you're sad when you have grief or complicated grief, but they're pretty different in that complicated grief, the person is absolutely able to have positive feelings, and they have a lot of positive feelings about the person who died. So many positive feelings that all they want is to have that person back. Whereas someone who's very, very sad and depressed doesn't want anything. They really are feeling like the world just doesn't have anything in it that's positive. The symptoms of complicated grief are really, in part, they're similar to symptoms of acute grief, where right after someone dies, so there's a lot of yearning and longing, even searching for the person who died, a lot of sorrow, and maybe some other mixed kind of negative emotions. And there's a lot of thoughts and memories of the person who died, and almost like a sense of disbelief. I mean, it's not that they don't know that the person died, but it's like a feeling like, how could this possibly have happened? That you have right after someone dies. So that's part of what complicated grief is. And the other part is what we call the complicating symptoms, which are a kind of very often sort of second-guessing kind of thoughts, and if only kind of thoughts that the person is very much thinking that if only I had done something different, or somebody had done something different, then that person would still be alive. So there are those kinds of thoughts. There's a lot of avoidance behavior, or trying to escape from the reality of the loss by focusing a lot on the person who died and the memories of that person. So it's either avoiding any kind of reminder of the loss, or escaping from the reality by almost like pretending the person is still around, or daydreaming about when they were around, in a kind of dissociated way. And emotions that continue to be intensely kind of roller coaster emotions, where they just come in these intense waves of sadness, yearning, and longing that the person just can't regulate at all. We don't yet know exactly why people develop complicated grief. We don't have good research data to answer that question, but from working with a lot of people, we have some ideas about that. And one thing is that women tend to get complicated grief more than men. Another is that people who have a history of anxiety disorders or depression seem to be more prone to getting complicated grief. Also, people who have complicated grief very often have had troubled relationships with their families, with their earliest caregivers. They've had to kind of struggle through that. And that makes them, it seems to make them a bit vulnerable to this condition. And also people who've lost someone in a very traumatic way, by suicide, homicide, sudden death, early untimely death, those kinds of circumstances of the death do seem to raise the risk of getting complicated grief. So again, the rates of complicated grief aren't exactly known, but it's roughly around 10%, 7 to 10% of bereaved people. So, you know, in the general population, probably about half or 60% of the general population is bereaved, and then 7 to 10% of them will develop complicated grief. So the good news is that complicated grief really can be treated, and that research shows that there is an efficacious treatment for it. That basically, though, it's different than just a general psychotherapy. It's not just going and talking and to someone who's listening carefully and kind. That's, of course, important, but the treatment really requires focusing on the ways that you can come to terms really with the reality of the loss, and also figure out a way to restore your own life. And this is done using some pretty specific kinds of procedures that can be emotionally intense, and that also require some kinds of activities that you're going to do between the actual therapy sessions. So it's an intense period of 4 months, short-term, limited, but intense while it's going on, and it's been proven to be efficacious. So the main thing is that it's easy to get down on yourself when you're grieving, and your grief isn't really moving anywhere. And sometimes people around you can start to feel kind of frustrated because they don't see you coming to terms with this loss, and they don't understand why not, and so they can get a little harsh, and then people sometimes do that to themselves and start to become very self-critical. And it's really important that you not do that, because this is not something that people have really control over. And in fact, we know that because we know that we can reliably identify the syndrome of complicated grief, and it's now been accepted into the diagnostic systems, both internationally and in the US, in the DSM, if you're familiar with that. So this is like any other, really like a mental disorder in that sense, that it's something that needs to be treated and can be treated, and it's not because you're a weak person or there's something very wrong with you as a person. It's not that at all. If you're the person who's supporting the person with complicated grief, you might be feeling a little bit frustrated. And what's really important is that you try to kind of manage those feelings and understand that this person is not really just wallowing in their grief. They're not being lazy or not trying hard enough. That's not what it's about. It's that they really can't get out of this place, and they do need to get help. And they need people that love them by their side and supporting them and being there for them and understanding that they're not themselves right now, but that having faith in them so that they can be, but they do need to get some help in order to get to the place where you want them to be and where they can be.